Well, from what your health care could look like to what it is right now. According to Career Builder, 1 in 4 workers say they don't pay attention to benefit changes when it comes to open enrollment. With employers looking to cut costs, some are changing and even dropping many of the health benefits that they once offered. So what should you look out for, and how do you decide which plan is best for you? Andrew Rubin is host of SiriusXM's Doctor Radio and Vice President of Clinical Affairs at NYU's Langone Medical Center. Andrew, great to see you again.
Good to be here.
All right, so we know our costs are going up, co-pays going up if you have them, premiums, deductibles, everything going up by about 10%. And now I hear that if you don't participate in open enrollment, some employers are going to cut your insurance. What is that all about?
Well, listen, healthcare costs going up and up. The economy is really tough. Corporations are looking to keep their benefits for their employees, but one of the ways they can save money is to shift some of the cost from themselves over onto the employees. And that's what you're seeing a lot with these self-insured plans. It hurts.
And they are telling some people, at least 10% of companies are saying, look, if you don't get in the plan, if you don't make a decision, if you're just relying on us to figure out what you had last year and put you in that plan this year, forget about it.
And there could be a lot of reasons for that. One is, in particular, is that some of the plans have changed. So it's not going from the same plan from year to year anymore. To save money, they've picked new plans. So they want to make sure the employee picks the right plan so that they're not on the hook for picking the wrong plan for you.
All right, let's do some basics here. Define HMO, PPO. What are they and what are the differences?
You know, it's so funny because they've been around for so long, but so many people still don't understand it. An HMO is essentially a plan that's tightly managed healthcare where you have to pick a primary care physician who manages your healthcare. So before you can go see any specialist, and you certainly can't go out of network in an HMO, the primary care physician directs where you get the care, and you have to stay in network. A PPO gives you a little bit more flexibility. You can go out of your healthcare network. You don't need a primary caregiver to tell you if you are allowed to go to a specialist. So it's like you get a little more freedom.
You can move around a little bit more.
You can move around a little more. Still restrictive, though. I mean, the financial incentives are designed in a PPO to keep you in network.
I want to talk about one of the big changes this time around. We're used to co-pays in HMOs, $15, $20 to go see your primary care physician, easy peasy if you have a problem, but that's changing, and now they're introducing language called co-insurance. What's that?
Well, co-insurance has always existed, but now what's changing is, like you said, co-pays are going away in some plans, and they're applying co-insurance amounts. It's very simple to understand. 10, 20% of whatever the bill is, the individual is going to pay, as opposed to $10, $20, $30 co-pays that used to apply. You're starting to see that more. It's not universal, but it's been introduced in a lot of places.
More out of my pocket. That's what I see. All right, I want you to talk about the high deductible plans, because 75% of employers offer these. I'm not sure it's a great deal for most people.
You know, I always tell people, I get this question a lot. I'm not a big fan of high deductible plans for people who are working and have other insurance options available to them. But as I say all the time, if it's a matter of going with no insurance or a high deductible plan, and you have that choice, you have that option, go with the high deductible plan. Because at least if something catastrophic happens, or if you're a young American, you have little fun, at least you have that protection that you're not going to end up with $200,000 hospital bills. You know, these are not easy decisions.
They're not easy. You really need to read those open enrollment docs. And one thing you mentioned, I just want to get in here quickly. Pick the right primary care provider, because it's going to be hard to go out of network.
It's so important. It's even before you pick the primary care provider, make sure if you're going with an HMO or even a PPO that your existing doctors are in your network. So if you like the doctor you have today and you're in an open enrollment period, make sure your doctor is still in that new benefit plan tomorrow.
Andrew, thank you so much for that.
Good to be here.
All right, digging out of debt. We'll introduce you to